Okay, so today we'll be starting about lessons from pharmacology. As we all know that pharmacology is an essential part of a lot of programs. Like in medicine, we do have pharmacology. In pharmacy, we have pharmacology. In nursing, we learn about pharmacology, and many other allied health subjects. We learn about pharmacology, right? So I've been getting some emails regarding to cover topics from pharmacology and KD Tripathi, as we know, is one good book. Lippincott is one another book. There are Kadzan. There are a lot of books who cover topics related to pharmacology. So what I've taken up is start picking up topics from all the courses relatively because they more or less are similarly covered there. So today's topic would be routes of drug administration. You can drop in the emails linked in my YouTube channel about what more topics you want me to cover, and then we'll go sequence wise. So I've recently covered a lot of topics regarding anatomy and physiology. So we'll move gradually with patho, and we'll also move with pharmacology topics. Okay. So first topic for today with the pharmacology, let's begin with that is routes of drug administration, right? So, whenever a drug is being administered, what are the parameters we take into consideration? One thing that the drug should be right, or we should mention that it should be a right medication, right? The right medication must be administered because if a or if I say if a non-specific, non-targeted, or any just random medication is being administered to a patient, then it will lead to a lot of adverse reactions. Okay, so let's list down all the possible or all the correct means through which a drug should be administered. Then we'll be learning about the different routes. So the right medicine should be administered to the right patient, okay, at the right time. Okay, so time of drug administration is very important because if you are not administering a drug at a specific time as specified, because the pharmacokinetics, pharmacodynamics, all these parameters we learn about in near lectures, so that also affects the drug bioactivity, that also affects the drug efficiency, efficacy, and a lot many parameters. The right route of drug administered has to be there, and why right route we know about it. So right medication, right patient, right time, right route, right documentation. So whatever medicine is being administered must be listed down along with your transcripts for future purposes. So these are few of the factors which must be taken into consideration before deciding a specific route of a drug or before prescribing any kind of a medication. So why right route is necessary? Because if we do not administer the medicine via a specific route or the right route or the appropriate route, then the person might suffer from allergic or anaphylactic responses or anaphylactic reactions. So any drug can show allergic or anaphylactic reactions if not administered via the right route. So let's learn what are these right routes. Okay. So the right routes are systemic, or the out of the numerous routes of administration, there are multiple ways through which many number of drugs could be administered. I'm not saying that one drug could be administered in all of these possible ways. We have a specific drug for a different route, right? So routes of administration include systemic and local. So first let's be aware of these terms. What do we understand by the word systemic? What do we understand by the word local? Okay. So local route of administration means that the drug is being applied at a targeted site or at a specific site. So in case of local route of administration, there are very less chances that the drug will enter the bloodstream. There are very minimal chances. Mostly the drug is applied at the affected area, at the damaged area, or at the site of injury, or at the site of infection, and there itself the drug shows its action. Okay, so I mean in the case of local administration of a drug, there are very minimal chances. There are chances, but there are minimal chances of drug entering the systemic route. So that is where we have another different category of systemic administration of drug here. So let's go back to local administration. So in case of local drug administration, we have classified into three different types. First is topical, second is arterial supply, and the third one is deep tissues. So in some cases, like let's take the example of lidocaine, the drug is being administered into a deeper tissue, drug is being punctured with the help of a syringe, into a deeper tissue so that it reaches the site. Here there are chances of the drug entering the systemic circulation at low levels. In case of arterial supply, yes, the drug is being entering a specific area into the deeper tissue, into the arterial supply, that is into the artery. Mostly in case of when we are treating somebody with chemotherapy or in case of cancer patients, this type of drug administration is preferred. Let's take one detailed understanding of what is arterial supply and what is venous supply. So when I say vein is basically collecting blood from the body and taking it to the heart. Now the blood can be pumped into different parts of the body. But when I say arterial supply, so arteries are mostly responsible or mainly responsible for carrying the blood from the heart to the tissues, that is away from the heart, right? So in case of arterial supply, the blood is moving away from the heart and is reaching to the parts of the body, right? So here, this kind of a drug administration is problematic. It creates a lot of adverse reaction, but is preferred in case of angiography, right? So in case of angiography, the contrast media is being injected, and that is how we can identify the different spots which are hit by cancer. And we can also treat patients like specific in case of femoral administration of a drug. In case of cancer patients, there also the arterial supply is preferred. Now we come down to the third different type of local administration. This is topical. So we all understand the word topical. Topical means something which is on the surface, right? So in case of topical administration of a drug, we are further classified into two different types. One is skin, like ointments, gels, creams, right? So they fall into the category where the drug is being administered on the skin. Again, at a targeted site in case of fungal infections, in case of all of these sunscreens, these ointments, in case of a burn. So in these cases, the drug is being administered directly on the target site. So there are minimal chances of the drug entering the systemic circulation also, but mostly it is targeted locally. The local targeting of the drug at the site of action. Then comes another category in case of topical administration, that is mucous membrane. So here the drug is being administered topically, but the drug is being absorbed by the mucous membrane. So the site of application of drug is the mucous membrane, right? So one is ophthalmic. That means we are talking about the eye. Optic or ophthalmic. We can also call it optic. So ophthalmic or optic, the eye drops fall into the category. Then we have throat. Here we have sprays that directly throw the drug into the throat region in case of infections, throat infections. We have vaginal and rectum routes of administration by the mucosal membrane. We have mucosal membrane in the vagina, in the rectal region, in the throat region, in the eye region. So in the vagina and rectum region, we have suppositories. So suppositories have both kind of action. They fall into the topical category also, and they fall into the systemic circulation also. So some suppositories, they show only localized action. In some cases, the drug is absorbed in the systemic circulation also. So they are directly applied in the vaginal area or the rectal area. Nasal routes, we have sprays, aerosols, mist for that, in which the drug is being sprayed directly into the nasal route, and through the mucosal membrane, the drug is being absorbed. Next, we have ear or the odic region. We have ear drops through which again the drug is being absorbed by the mucosal membrane here. So now moving on to the next category, we have systemic route of circulation. Systemic route of circulation basically focuses on when the drug is being absorbed at via different routes, but ultimately the drug will reach to, I'm just removing this so that we can discuss the systemic route in a detailed manner. So what did I mention here? That in case of systemic, we are mostly talking about the drug reaching to the bloodstream. Okay, here the drug is reaching to the bloodstream, right? But the category falls variably on the basis of the on the route of administration. So in some cases, the drug reaching to the bloodstream is higher in quantity, or I will say highly efficacious, higher in bioavailability. In some cases, the quantity of drug will be lesser. And why is even that here? Because in some cases, the drug is choosing a different passage in which it is metabolized. I hope you all have learned the word about metabolism. I hope you also learnt about FPM. If not, we'll take up such topics in detail. We'll cover the entire pharmacology syllabus. So yeah, there are different ways which we'll be learning on out in the future series where the drug is being metabolized through first pass metabolism and through many other different routes by passing through the gastric region where it is being destroyed by the acid of the stomach or of the gut region, and the active drug reaching to the bloodstream would be much lesser in number than that administered, right? So clearing this off, we have systemic route of circulation. In systemic route of circulation, we have either enteral route or parenteral route. So let's first cover the enteral route. In enteral route, we have oral route of administration, cutaneous, sublingual, rectal and nasogastric. So let's first cover the oral route of administration. In oral route of administration, we have tablets, we have capsules, but there is one disadvantage to that whatever drug we are consuming. Okay, first of all, let's come back to this term enteral. What do we mean by the term enteral? So it's a very common question that anything which is being absorbed by the gut region or the stomach region. So if the drug is being absorbed ultimately by stomach region or gut region, that means the drug is enteral, right? Is choosing the enteral path. But here on the contrary, I am saying that the drug is being absorbed by the mucous membrane. Okay, so now you know by which term what are we referring to. So in case of oral route of administration, tablets or capsules are being administered, they have to pass through the stomach acid and then ultimately they are reaching to the intestine where they are being absorbed. So the drug which are being administered by such routes have a tough coating, okay, because if they will not be bearing a tough coating, they will be destroyed by the acid of the stomach. So they have a tough coating which prevents the drug from being broken down or which reduces the quantity of drug being destroyed in the stomach, and when they reach the intestine, there they have a basic pH where the drug can easily be dissolved and dissociated and absorbed, right? So this is what is oral route of administration. Next we have cutaneous route. So in cutaneous route, we are talking about the application of the drug on the skin, right? In skin, we also have another category that is topical, and we mentioned about the local. So in some cases, the drug applied on the skin is only reaching to the superficial side. But in some cases, the drug applied on the cutaneous region will also enter the systemic circulation. That is why, like in the case of rectum and vagina, I have placed them into both the categories, in local also or systemic also. In some cases, the drug will only act at its site of action, that is locally. In some cases, the drug will also enter the systemic circulation. Got it? Okay. Next one is rectal. Again, in the rectal region, in the vaginal region, with the help of suppositories, the drug is being entered and the drug is also entering the bloodstream. That is why we have placed into this category as well. And next we have nasogastric. So I hope the word is somehow clear. So there are nasogastric tubes. These nasogastric tubes are usually used on people who are unable to swallow a drug. But here the drug can only be entered via the enteral route, or the drug can only be absorbed by the enteral route, but the person is either unconscious, okay, or the person is unable to swallow. In either of the cases, there is a pipe which is attached to the nose of a person or directly to the mouth of the person, which goes in deep to the stomach. So the drug is being targeted, or the drug is being delivered into the stomach, into the gut region with the help of a tube, in case of a person who is either unconscious or unable to consume the drug, unable to swallow the drug. So the pipe is either attached on the nose region or on the gastric region, that is directly into the stomach region, right? I hope this is clear to everybody. Now we'll move to the most important part, that is the parenteral. So what makes the parenteral route important? In parenteral route, we can have a detailed discussion in future lectures where we'll be learning about basic advantages and disadvantages when we can compare one route of administration of drug to other routes of administration of drug. But currently, I'm just making you aware of all these terms and what do they mean. Later on, we can carry out like proper lectures for these and give out examples also. So this one is just introductory one. So in case of parenteral, we have two different categories where we are labeling the drugs which are directly being injected into certain layers or veins or skin, and then we have inhalational and transdermal. So let's first cover this off. Inhalational and transdermal. In case of inhalational, we have sprays, we have aerosols, right? So these kind of things there are present, and in here, with the help of sprays and aerosols, the drug is being directly injected into the or thrown into the lungs. The drug is entering into the lungs, and what route is it taking? So the drug particle must be small enough to actually enter the trachea. Okay, if we have learned about the respiratory system, we must have learned that after the pharynx, whenever we are following the respiratory system or the respiratory tract, the air enters into the windpipe, right? That is the trachea. So aerosols and sprays must be small enough to enter the trachea. Similarly, we did have nasal route, but here the particle size could be larger. But in this case, the particle size has to be smaller because it has to pass through trachea, move to lungs, and we have alveolar epithelium in which the drug will be absorbed and enter the systemic circulation. Okay, systemic circulation. So this is the inhalation route. Okay, and then we have transdermal. I hope the word itself says its meaning. Dermal means we are talking about skin. Okay, and transdermal, we have transdermal patches. These are very common nowadays, and here the drug is being absorbed or slowly released into the systemic circulation, right? So here they are categorized into the parenteral route because and into the systemic because they are making the drug enter into the bloodstream. So I'm clearing this off and focusing on the last one, that is injection via the injecting of the drug via different passages. So here the first one is IV, that is intravenous. Then we have intramuscular, we have subcutaneous, we have intra-arterial, okay, we have intrathecal, and we have intradermal, okay. So there is one slight difference. Let me first clear it off with these two, intradermal and subcutaneous. In both the cases, the drug is being administered in the human skin. So we have learned a lot about the administration of drug via skin. You know why we have put them into different categories. I have discussed it recently. So in subcutaneous and intradermal, there is only a category of how deep the drug is being administered. So in case of intradermal injection, the drug administration is bit shallow. In case of subcutaneous, the administration of drug is deeper, from 45-degree angle or so on. In case of intravenous, the drug is being directly injected into the blood vein, through which it passes into the entire body. In case of intramuscular, the drug is being administered into the muscles where there is lesser vascular supply, more of muscles. The vascularity is less here. And in case of intra-arterial, the drug is being administered. Okay, when I say intra-arterial, sorry, I'm so sorry here. It is articular. It is articular. I think so we have learned about intra-arterial here, this arterial supply. So this arterial supply was for patients who are suffering from cancer, for angiography, for treating a specific targeted area because the drug is being moving away from the heart. But in case of intra-articular, where do we use the word articular? I hope you've heard about this word somewhere in case of joints, in case of skeletal system. So whenever a drug is being administered or injected, basically injected, these are all injection routes. So drug is being injected in case of a body joint, a joint of a body between two bones, like in the case of treating arthritis. In those cases, if it's pain, that area is painful, inflammatory, in all those cases, if a drug is being injected directly into the joint, in that route is called as intra-articular. Then intrathecal injection, when the drug is being injected around the spinal cord, right? So I have covered all of them. I take a quick revision of all of these so that you get familiar with them. Routes of administration, the drug has to be administered in a correct way at the right point of time, by the right route to the right person, and the right medication should be administered to avoid any kind of an allergic anaphylactic response. Drug could be either administered locally or systemically. That means when I say locally, the drug is being applied on a targeted site. It has a specific action only to a targeted site, and there are very less possibility that the drug will reach to the bloodstream. In case of systemic, the drug reaches the bloodstream. They are either enteral. Enteral, that means the drug is being absorbed at the gut region, or the drug is being injected via the parental route. In case of enteral, we have oral, cutaneous, sublingual, rectal and nasogastric. Oh, I missed the sublingual one. I'm just covering it up. In case of oral, we have tablets and capsules. In case of cutaneous, the skin ointment creams in which the drug is passing and entering the dermal layers and entering into the bloodstream. In case of sublingual, a very important one, I hope you have learned about glyceride trinitrate. In case of sublingual region, this is basically the buccal area, the buccal cavity. Either the drug is kept under the tongue or in between the cheeks. Here, the drug is being absorbed by the mucosal layer and enters the bloodstream. So, we can prevent heart attack in a person by administering a drug via the sublingual route. Okay. So then we have rectal region. In the rectal region, we are basically covering we are making the drug enter via the rectum and with the help of a suppository where the drug is being entering into the bloodstream. In nasogastric, the drug is entering either through the nasal route or through the gut region with the help of a pipe where the patient is unconscious or unable to swallow a drug. Okay, so these drugs will only be applied or can only be absorbed via the enteral route. In case of local administration, topical, we have skin, or the drugs are being injected into the deeper tissues, or there is an arterial supply. Then deeper tissues, I did mention that the drug might enter into systemic circulation, but largely it is focused on the targeted area. In case of topical administration, the mucous membrane, the drug is being administered through the mucous membrane either via the ophthalmic route, that is eye, throat region with the help of sprays, vaginal or rectal again with the help of suppositories, nasal sprays and the eardrops. Okay, in parenteral we did have inhalation and transdermal routes. In inhalational injection, the drug is being allowed to enter the body with the help of sprays, with the help of aerosols, but the particulate matter should be small enough to enter the trachea or the windpipe through which it will enter into the lungs. And when it enters the lung, it will easily be absorbed with the help of the alveolar epithelium. We have transdermal routes again with the help of skin in the form of transdermal patches. Injections, we have intravenous, intramuscular, subcutaneous, intra-articular, intrathecal and transdermal. Intravenous, the drug is being directly injected into the vein. Intramuscular, directly into the muscles. This is having lesser vascularity. In case of subcutaneous, into the skin, transdermal and subcutaneous, there's a little difference where intradermally, the drug is administered at a little shallow level. Here the drug is administered at deep levels, both in the skin. Intrathecal is around the spinal cord and intra-articular is around the joints, the bones, right? So I think I've covered all the routes of administration. So if you have any more topics, you can email that to me. I have mentioned my email in my description of the YouTube channel, and we'll be largely focusing now on pharmacology because a lot has been covered from anatomy and physiology, and I think so this will benefit a lot of medical aspirants, a lot of medicine students, the nursing students, pharmacy students, pharmacology students, and I wish to take these lectures forward with all of you. And do like, share and subscribe my videos and drop the topics in my comment section. That will be mostly welcome because it reflects directly underneath the videos and I'll get to know what topics you want me to cover. Thank you.